So my name is Dr. Navin Chandra. I'm a consultant cardiologist who specializes in interventional cardiology. I'm based out of Frimley Health NHS Foundation Trust and also have an honorary role at Royal Brompton and Harefield NHS Foundation Trust. I practice for private patients at the Parkside Suite at Wexham, also the Harley Street Clinic and Princess Margaret Hospital in Windsor. So the truth is, I think I made the decision to go into medicine at quite a young age. I was always fascinated by anatomy and how the body works. And actually that kind of led me to focusing on the heart. I remember being an A-level student when I was much younger, and we were learning a little about the heart and the cardiovascular system. And I was quite fascinated by how such a simple thing, such a simple organ can be responsible for so much. And certainly when I went to medical school myself, after that, my interest and passion for this grew and developed more and more. And I became particularly interested in the sort of physiology of how the heart works and how the cardiovascular system works in synergy with the rest of your body systems and overall health. And as I started my medical training, I obviously tried to pick posts and jobs that had allowed me to develop my interest in cardiology and to see more and more patients with cardiovascular disease. And again, I became more and more passionate about things from there. Ultimately, I did a lot of specialist training in cardiology via the London Deanery, and have even traveled abroad and done fellowships and posts in Canada to help develop and further my interests, and obviously focus particularly on interventional cardiology, as I am quite keen on practical procedures, and I do like the idea of being able to do a procedure or an intervention that's going to help somebody and make somebody feel better. So I have to say, the thing that I find most rewarding is interaction with patients. Often when you see a patient for the first time, they have some worry and some anxiety as to why which is why they've come to see you in the first place. There may be some symptoms or some specific questions or queries or concerns that they have, and they want to kind of go through with you. And what I like doing actually in particular is talking them through the tests of what we're going to do once I've spoken to them and taken a clinical history and evaluation, and explain what we're looking for and how we're going to get to the right answer at the end of it all. And actually perhaps the most rewarding part is the follow-up consultation, when you actually see them with the results of their test, and you can start explaining things about what you found, what it means, what needs to be done, whether you can just provide simple reassurance, whether you need to just give medications, or whether you need to even plan to do a procedure. And seeing the patient at the end of that follow-up consultation often is what I find the most rewarding, because you can see that their questions and concerns from the initial consultation have now been listened to and understood, and they're able to understand that you've found a reason as to what you're going to do and how you're going to get to the right management for that individual. And I find that process quite rewarding. As an interventional cardiologist, I'd be lying if I say that I don't enjoy doing procedures on patients as well. Obviously, this is when it's appropriately indicated and it's going to be of benefit to them. I myself, specialize in treatment of coronary artery disease with implantation of coronary stents to help blood flow to the heart. I also put in permanent pacemakers for people with electrical heart muscle disorder, electrical heart disorders, and I also treat valve disease, particularly the aortic valve disease, with procedures called TAVI. So there's a number of practical procedures that I like doing as well, which I do myself find rewarding, as there can be, every patient's different and all has individual technical aspects of the procedure, which is different and can be challenging. And I like working through those problems and working together with a team to get to the right outcome for each individual patient that I see.